I'm P.V. Rao. I was a former professor of endocrinology in Nizam Institute of Medical Sciences for about 25 years. I retired about 4 years. Many of us have diabetes, and we somehow feel that diabetes is related to obesity, that's weight gain, or people who are overweight or obese are getting diabetes. But it is not really true. About 30% of the people with obesity, people who are overweight, they develop diabetes. But the remaining 60-70% may not develop diabetes. Similarly, if you take all the diabetic population, only about 30% of the people with diabetes may have obesity. So it's not really a bidirectional issue. So some people with diabetes may not be obese. At least in India, most of the people with diabetes are not obese, not overweight, they are normal body weight, and some of them are even underweight. So diabetes may or may not be related to obesity. This is a major understanding and thinking all over the world now, that we should not relate diabetes to obesity alone. But of course, because we know that at least 30% of the people with obesity are definite to develop diabetes, we want to prevent diabetes by making people aware of this, and they should not put on more weight than required. So the weight is always measured by body mass index. So weight in kilos divided by height in meters squared is body mass index. So suppose the body mass index is more than 23, they are overweight. If they are more than 25, then they are obese. So in India, most of the people have their body mass index between 19 to 25, but some people may have overweight or obesity, and their body mass index, the BMI, may exceed 25. So those people are more prone for developing diabetes. So it is not always true, but because we know that at least 1/3 of the people with obesity are prone to develop diabetes, the most important risk factor which we consider for development of diabetes or for prevention of diabetes also is obesity. So we should know our ideal body weight based on our height, that is a basal BMI measurement. So BMI between 19 to 25 is a must, and everybody should achieve that kind of a target. We should not exceed BMI of more than 25, and most of the people with BMI less than 25 may not develop diabetes in near future. So that is a important risk factor for diabetes. Apart from this particular risk factor, we also know that aging is a most important risk factor for diabetes. People who are aging, that means anybody after 25 years may develop diabetes. After 40 years, the chances of developing diabetes are much more common. Similarly, people above 60 years may have more chances of developing diabetes. So diabetes is an age-related disease. So people more and more aging, they may have diabetes. But it is not very scary. So it's something like a graying of hair. So it's not going to cause a great harm to you. So similarly, skin is dry and rough, and it gets folded while aging. Similarly, diabetes is also one of the milder chronic degenerative disorders associated with aging. It's not a major problem like a viral infection or like a heart problem. So diabetes is basically one of the medical conditions related to aging and obesity. That is all for sure. We know that these two are the known risk factors for diabetes. Aging, anyway, we cannot reverse aging, but we can actually prevent obesity, or you can even reverse the obesity situation also. So these are the two known major risk factors for diabetes. But people talk about so many other risk factors, like nowadays people say that if you are not doing hard work, then you become diabetic. But nowadays we are seeing more and more farmers from agricultural professions from rural areas are also getting diabetes. So we cannot really pinpoint a particular physical activity is responsible or not responsible for diabetes. But we also say for whatever benefit it is, we tell them that you have to improve on your physical activity levels by doing a normal exercise or a normal walking or a regular activity. So physical activity is a weak risk factor. Physical inactivity and leisure patterns are a weak risk factor for diabetes, but because though we are not very sure about its relation with the diabetes, we say that you have to be more physically active, and you have to cut down on your leisure time, and you have to get involved with more and more professional or non-professional activities that involve more physical activity. Whatever, it doesn't mean that you have to start running or doing any hard exercises, but basically anybody who is walking for more than 20 minutes a day, and then that is 5 days a week, that is enough. So you don't have to do any great hard work, or you don't have to go to gym for prevention of diabetes or for treatment of diabetes. Suppose somebody has developed diabetes already, you don't have to tell them to go and start doing any hard unaccustomed exercises. That's not really required. So anybody who does a normal routine exercise, that is enough for prevention of diabetes or for treatment of diabetes also. So apart from obesity, aging and physical inactivity, there are so many other risk factors which may or may not be related to diabetes. The next issue that comes into picture is the diet. So people say that diabetes is strongly related to diet. So it's not really true. So we have not found any great confirmatory evidence from dietary constants as related to diabetes. But people say that if you are eating too much sugar, you will develop diabetes. It is not true. That is definitely not true. Suppose if you are eating more sugar, you will have more calories, and if you put on more weight, then you may become diabetic. But just by eating sugar, cane sugar, you don't become diabetic. So sugar may spoil, it may affect your teeth, but not diabetes. But suppose some people are using these high fructose corn syrup, HFCS, that is mostly the syrup used, very high concentrated sources of energy in cool drinks and beverages which they use. That may add up to your calories and you put on weight. So if you are putting on more weight, then you are more prone for develop diabetes. That's how diet may be indirectly related to causing diabetes by adding up your calories and by making you to put on more weight. But a single dietary constant like a fruit or like any of the routine Indian materials what we are making every day for eating, so even if they have some sugar, some cane sugar inside, that is not going to make any great difference in you becoming more diabetic. So it's not really worth trying to stop eating sugar, or not worth trying to cut down on your sugar. It's a common unnecessary myth that people say that I have diabetes, so don't put on sugar. It's not going to help you prevention or in reducing your diabetic status also. So diet has very little effect on diabetes, but if your diet increases your body weight, then you are more prone for developing diabetes. Apart from this, there are so many known or unknown risk factors. Nowadays mostly we are all talking about pollution. There is so much of pollution around. There is air pollution, there is water pollution, there is food pollution. So most of the foods what we are using, they have some poisonous materials like organophosphorus materials, and then we have the air pollution with materials from plastic toxicities. So all these things also contribute to diabetes. So right now we do not have any major evidence to prove that either of the dietary constants or even the pollutions have any effect on diabetes, but we have some superficial knowledge on some of these activities. So pollution also may add up to the diabetes problems. Recently they also added the wood fuel. So the fumes which are coming from burning wood all over India and most of the countries where most of the states where we have winters, harsh winters. So people try to burn different materials like wood and others. So the smoke that is coming from this wood is also responsible for heart diseases and also diabetes. So these are all new findings that are coming out from the literature, but we are not really very sure that a particular risk factor. Apart from obesity and aging, so far we have not found any confirmatory evidence to prove that one of the risk factors is 100% causing diabetes.